Hi, everyone. My name is Dr. Michael Wald, and welcome to this presentation, which I call Gut Instincts. And the reason I call it Gut Instincts is because I hope to make clear through this practical and fairly brief discussion about the intestinal tract that if we do learn a few things about how bodies responds to foods, for example, or supplementation, or the signs and symptoms that some of us experience, we could play a significant role in restoring our intestinal health to optimal levels. So this will be, as I mentioned, a fairly brief but practical presentation. There's more information on these slides than I will actually go over with you verbally. So if you'd like a copy of this PowerPoint presentation, you can contact me, Dr. Michael Wald, the Blood Detective, at 914-552-1442, or email me at info@blooddetective.com. So let's get into gut instincts. First, I'll begin by just reading the disclaimer or paraphrasing it simply by telling you that the information that I'll be discussing here today is for your educational purposes only. It is not meant to substitute for sound medical health advice. So over my 30 plus year career, I've seen quite a number of gastrointestinal issues. In fact, I taught a 2-year gastrointestinal seminar to physicians and other types of nutritional and natural practitioners across the country for many years, and I learned a few things, and I'm trying to give you as much as I can in this tiny little talk so that when you see a healthcare provider, number one, you don't sound like an idiot, to be honest. You want to be able to use the proper words, the proper terms, so that when you're working with a doctor together on your health, they take you seriously. So what are some of the more common gastrointestinal symptoms that are out there? Certainly I've seen them over the years. Would be gas and bloating, constipation, diarrhea, intestinal discomfort like cramping, reflux or heartburn, irritable bowel syndrome, inflammatory bowel disease. Remember, irritable bowel syndrome is just an irritable bowel. It's not functioning right. And inflammatory bowel diseases are 2 autoimmune conditions, Crohn's disease and ulcerative colitis, and actually a third condition called proctitis. And then there's vomiting, there's loss of appetite, increased appetite, unintended weight loss, which is a big one that concerns all sorts of healthcare providers with any training. They know that weight loss that's not intended could be an ominous sign of cancer, not always. And then there's jaundice or mucus and or blood in the stool. So these are just some of the gastrointestinal symptoms that you may be experiencing. Now, gut problems can produce symptoms that have nothing to do with the gut. For example, someone might have a gut issue with gluten metabolism, and that might cause something called cerebellar atrophy. That's brain shrinkage. So we're talking gluten in the diet can cause that specific condition, but a gastroenterologist wouldn't think of looking at the brain. So, and unfortunately, medicine is so compartmentalized that the gastroenterologists do not talk to the neurologists, and they don't talk, and these different doctors simply aren't talking. But the blood detective approach to gastrointestinal disorders is truly holistic. I don't give lip service to looking at as many areas of the client as I can. So when I do testing, it's from all areas of medicine at one time. Common sense simply tells you you're going to see more. So what I'm trying to say here is that gastrointestinal problems can look like non-gastrointestinal problems. Cerebellar atrophy from gluten intolerance I just mentioned. Let's say someone has malabsorption of certain B vitamins. They might have neurologic problems from that, which can range from pins and needles to numbness to problems with sensation and orientation and even muscle power. So keep that in mind. Let's start by me giving you a brief anatomy lesson of the gastrointestinal tract. And I'm going to do it in a way that you might find useful. So, for example, many people that I see that are sort of into the natural field, they've heard of this concept of pH and how the body's pH should be alkaline. Have you ever heard that? Well, if you haven't, it's that simple, but it's wrong. Because we need to be alkaline, our pH, alkaline in our mouths for starch digestion, which requires an alkaline pH for the enzyme amylase to work properly in the mouth. We need to be acid in the stomach. We need hydrochloric acid and pepsin and other enzymes to help digest foods within a pH which is somewhere between 4 and 6. And then in the blood, let's say the capillary blood or arterial blood, we want a pH between 7.35 and 7.45. So that's kind of in the neutral area. I'll give you one more example. And in the urine, we want to be on the slightly acid side. Urinary tract infections tend to happen when the urine is too alkaline. That's why when people take acid dophilus, which helps to reestablish the acid environment in the urinary tract, can help cure urinary tract infections about 30% of the time. So my point here is that we need to have some knowledge of where the proper pH should be, and let's leave that concept aside now. So as you can see from this picture, we consume foods in our mouth, it goes down the esophagus, then there's a valve between the lower end of the esophagus down here and the stomach known as the gastroesophageal valve. That is controlled by neurohormonal signals. So if someone has a neurologic problem or hormonal problems or a combination of both, that might have caused their gastrointestinal problems, and they need a neurologic and hormonal problem to cure it, not a gastrointestinal problem. You know, I was speaking with a client just a couple of days ago who is very smart in nutrition and had some constipation. So he went to the gastroenterologist, and the gastroenterologist said, you need to have more fiber, water, and that sort of thing. And all of those lifestyle things this client was doing like to the T. It turns out that I identified in him that his constipation had nothing to do with fiber, nothing to do with hydration, and nothing to do with his diet. It had to do with the fact that he had neurological issues in his nervous system, and the nervous system goes to the intestinal tract, that tube. The nervous system pierces that like wires, and it's those neurologic impulses through those wires that cause the intestinal tract to work well, along with, as I mentioned, hormonal signals too. So this person, though, needs a neurologic approach for his gastrointestinal problems. And we can see here that aging impacts all aspects of the gastrointestinal tract. We have, as we grow older, our ability to produce stomach acid, our ability to produce pancreatic enzymes, which help us digest our protein, carbohydrates, and fats, they diminish. That can cause malnutrition or malabsorption and all sorts of health problems depending on what is malabsorbed. So, for example, if someone isn't absorbing the appropriate fatty acids, they might have hormonal issues from that, like that could look like infertility. Someone might be malabsorbing protein, so they can't get the amino acids we get from proteins for the neurotransmitters in the brain, so that might be dementia. Another person may malabsorb, let's say, zinc, and they might have immune problems and they keep getting infections. So we've got aging, hormonal decline, stomach acid decline, autoimmune diseases. That is where the body sort of attacks its own tissues. Therefore, autoimmune is the definition there, and the tissues break down. And then chronic stress. And those are the key ones. And then in terms of the intestinal tract, we always want to be mindful of a condition known as leaky gut syndrome, because it is extremely popular. And basically, it's a condition where there is malabsorption, and then there's inflammation, and there is the leakage, you might say, of bugs that go from inside the intestinal tract through the leaky gut out to the outside of the intestinal tract and even into the bloodstream, where these bugs, cocci, rods, L-form bacteria, candida blastospores, for example, they release inflammatory mediators and other toxins, which can create problems that are, that extend beyond the gastrointestinal tract. So we want to always check for leaky gut syndrome in any gastrointestinal disorder or any chronic health problem for obvious reasons. Now, as far as the types of tests, we have stool analyses where we can check for the microbiota or the bug balance in the intestinal tract. Also, we can check for the presence of candida or digestive enzymes and probiotics. We can also, as I just mentioned, check for specific leaky gut markers. And in addition to the enzymes I mentioned, we might want to check food allergies on a person. So a person might have any number of health problems because their gastrointestinal tract is having allergic reactions to foods, and allergy by definition means that the immune system's involved, or the immune system may not be involved, and someone might just have problems digesting specific foods. And then we want to check sometimes for inflammatory mediators like lactoferrin and C-reactive protein, which have connections to gut problems. And as we move along, we can do a small intestinal bacterial overgrowth test known as a SIBO test. We can also check for stomach acid. There's a few different methods to do that. And then there's comprehensive parasitic tests where we check for parasites, as in wormy sorts of parasites. We can check for micronutrients, either vitamins, or in addition to vitamins. Micronutrients refer to minerals like zinc, magnesium, and calcium. And then we can also do some micro mapping with RNA sequencing. So again, these are just some of the available tests that a knowledgeable practitioner will review with you and let you know which ones seem to provide the most potential for uncovering what's going on with your gut and what to do about it. Then I thought I would just review quickly the top 10 gut supplements. Now, these aren't really the top 10. They're just common supplements that people think about for the gut. And you or someone else with gut issues might require some of these. But then again, you might have gut problems, that, as I mentioned, from a neurologic problem or gut problems because of a blood flow problem. And then you might need nutrients that are completely different than nutrients for gut problems or gut proper problems. So for example, everyone thinks about probiotics, but probiotics are not the same. So one probiotic might be really good for anxiety and depression, and another one for leaky gut, and another one to work with specific types of antibiotics you may be taking or have taken in the past. So that's something to think of in terms of probiotics. You want to get the right probiotic at the right dose and the right type for the right person. And then there are prebiotics like inulin and fructose oligosaccharides, also known as FOSs, or various fibers. These are required to remove toxins from the bowel, to stimulate bacterial growth, to help reestablish a normal gut flora. And then I've mentioned a few times digestive enzymes. We're not what we eat, right? We're what we absorb from what we eat. So enzymes and acids are important. So a very good practitioner will be able to figure out for you, do you need fat digesting enzymes, protein digesting enzymes, amino acid digesting enzymes? What do you need? How much do you need it? When should you be taking them? And then there's glutamine. Glutamine is an amino acid that is required for healing. It's used as fuel for the enterocytes in the gut to replenish themselves. Those are the gut cells. And then various collagen peptides. There's a few more basic nutritional supplements I'll just throw out there for the gut. And again, you might need some of these or none of these. And then the amounts you need, again, need to be based on your lean body mass and your metabolic rate. Those are determined through what's called a bioimpedance test. But back to the supplements. There's slippery elm and marshmallow root, which helps digestive inflammation. Zinc carnosine, also very good for inflammation and ulcerations in the gut lining. Omega-3 fatty acids, another anti-inflammatory compound. And when I say anti-inflammation, there are different types of inflammation. So these different nutrients may work on some of the same types of inflammation, but also on different types. So together, they are best. And then the use of magnesium and vitamin D, very important for gut health, for neurologic health, for heart health. We can go on and on all day about vitamin D. So the approach that I take, I have termed the blood detective method or blood detective approach, because it is a holistically minded approach. We want to look at dietary factors that might help a person, exercise factors, sleep factors, stress factors, nutritional supplement factors, food factors, and other types of natural therapies and treatments. And then the blood detective approach is not merely a disease care approach. I'm not simply waiting around for your test to say there's a big disease, although I have many clients that see me with that, and in fact that I diagnose with disease. But we also want to do testing that uncovers smaller problems, meaning that there are problems, but they're at a level which we can do something about. So we want to do preventative testing on some sort of regular basis to identify problems when they're early, because earlier problems are far better and easier to deal with than larger problems that are chronic. We want to also compare a person's results to these various testing we do for the intestinal tract, not just compared to average men or women their age, but compared to healthy people with the best gut function. Believe it or not, there are different ranges of optimization where you should be for healthy people or average people. I compare my labs to that of a 20-year-old. Are all my labs in the 20-year-old range? No. But most of them are in the 30 to athletically 40-year-old person, and I'm a 58-year-old man. So you want to have a higher standard than your biological, or I should say your chronological age, because we want to improve biological aging everywhere. And then the testing in a blood detective method has to be from all areas of medicine. If your gastroenterologist is not going to do nutrition tests, then that's a problem. If you also have neurological problems that are caused by a gut problem and your neurologist won't do gastrointestinal tests, that's a problem. If you have heart disease like high cholesterol that's causing lack of circulation to your intestinal tract, causing gut problems, and your gut doctor doesn't know anything about that, then these connections are lost. So the blood detective method considers all of that. So that brings us to the end of this presentation, and I wanted to offer everyone listening a free 15-minute opportunity to speak with me either by phone or through email or Zoom. You can contact me at 914-552-1442, and you can email me at info@blooddetective.com and take advantage of all of the free content. There's a ton of content, particularly under the podcast sections on my website at drmichaelwald.com. Thanks very much. We'll see you at the next talk.